This video is one of the series produced by the Georgia Department of Public Health. Its purpose is to provide training for non-clinical volunteers to enable them to perform basic health care tasks and take pressure off professional medical staff in the event of a wide-scale emergency. Every hospital is different, so check with your supervisor to learn about protocols that are specific to your hospital. While watching this video, please remember these things. As a non-clinical volunteer, you will not be called on to perform any clinical task or to make judgment calls on patients' treatment needs. If you encounter anything unusual or something that you don't understand, you should immediately consult a registered nurse or another healthcare professional. The Georgia Department of Public Health appreciates your help and thanks you for volunteering. A patient's vital signs like pulse rate, temperature, and respiration rate give warning of any problems and provide a snapshot of the patient's condition. You should take vital signs while the patient is at rest, not immediately after they've been active and not while they're eating. To take a patient's vital signs, you will need a portable vital signs machine. This machine is required because non-clinical personnel must not take a patient's blood pressure manually. First, remove the blue oral probe from the temperature machine and place a cover over it. Then, place the probe carefully under the patient's tongue. When the probe beeps, remove it from the patient's mouth and start recording the temperature. Press the timer on the temperature machine and count the number of breaths the patient takes over a 30-second period. Multiply that by 2 and record the temperature. Now, place the blood pressure cuff on the patient's upper arm midway between the elbow and the shoulder. Next, press the green inflate or stop button in the upper right corner. Finally, record the patient's blood pressure and pulse rate.